My name is Dr. Elizabeth Leroux. I'm a neurologist and a headache specialist in Montreal. And I do, my life and passion is to work with people who live with headache disorders and especially migraine. So I was fortunate enough recently to be invited to give a talk to something called Benefits Canada. Benefits Canada is an association that regroups insurance companies and employers to educate them and to provide them information about different workplace relevant topics. And so I did one webinar in English and one in French. More than 750 people registered. So that means there were a lot of employers and insurers on the line. And so what they wanted to know is, what is migraine? Is it a real problem? What is the impact of migraine in the workplace? And why should we pay for drugs such as Botox and CGRP antibodies? Is it worth it? Does it earn us anything? The webinars were extremely successful in that the most attendees, actually 97% of them, said that they learned about migraine and they were more likely to consider migraine in their future choices. So this is the type of initiative that pays off from Migraine Canada. So we can influence the system, the famous system that has impact on you at the end of the day. So, generally speaking, the benefit consultants will actually decide which drug plan to buy, and that this is a drug plan that you as an employee will have. All right, so I hope that's clear enough. So I will just proceed with questions and deliver the answers. So I already explained why the audience of employers and insurers are important. Obviously, the insurance companies provide the pay for the drugs, and then the drug plans, the employers, of course, if they know about migraine, well, they will be more likely to understand you and to provide you workplace accommodations that can help you to work better, even if you have migraine. And of course, the employers are the clients of the insurance companies. They buy the drug plan. So we want them to know what migraine is and to understand migraine. So one thing I covered during the webinar was presenteeism. Presenteeism, it's a bit of a technical term, but I'm sure if you live with migraine and headaches, you know what that is. It is that when you have a headache or a migraine attack and you cannot just take off, you have to go to work. You go, but then you're slowed. You have nausea. You are sensitive to light. You're irritable. You have brain fog. So obviously your brain is not able to deliver your best at work. And so you're there, but you're not fully productive. So that's what presenteeism is. And this is something that is studied a lot in the workplace. And so we could wonder if migraine has a significant impact. And the impact of migraine on presenteeism is massive. It is massive. There's actually research showing that migraine is probably explaining up to 16% of all, if you take all diseases together, migraine is a very significant cause of presenteeism. And if you live with migraine and you've ever worked with a migraine, you understand this. So we want employers to be aware of this and to do something about it. Because if you want to work your best, you have to be well treated for migraine. Another thing that we questioned was, why do insurance companies have criteria to cover things like Aimovig, Emgality, Ajovy, and Botox, and soon Vyepti or Gepants, right? Well, obviously, an insurance company has to make decisions. They have to decide what to pay for, and they will ask you to try things that are cheaper that may work, such as oral preventives, the pyramid, propranolol, and the triptyline, before they decide to cover things that are more expensive. So that makes sense from a business perspective. From a medical perspective, sometimes we wish we could just try, the CGRP antibodies or Botox right away, because they are more tolerated than a lot of oral preventives. This being said, as a clinician, I do see people who fare very well with oral preventives. So far the idea is that you try some oral preventives and then you have access, for coverage at least, to second line options. Now, some drug plans do not cover for these options, and that's where we really need to push to tell them that migraine is a real problem, it has an impact on the workplace, and they should be covered. One example came up as a combination of Botox and CGRP antibody, taking both together. Why is that not covered or declined by many insurance companies? And the obvious answer to that is that, well, it's more expensive. And the argument that the insurance companies use is that there have been no studies, right, showing that there is a benefit or that it is safe. The agreement of experts about the combination of Botox and CGRP antibodies is that it is very safe because Botox does not interact with mostly any medication, and CGRP antibodies do not interact with oral medications or Botox or for most part other antibodies. So it is something that you can advocate for, and we at Migraine Canada we have some tools to help you do that. Another thing that we discuss with the employers is that how does migraine compare to epilepsy? Because everybody, I mean, people who have epilepsy are not questioned that much, about do they have a real problem. And let's go back in history just to say that epilepsy in the past was a demonic possession. Why? Because there was no proof of what it was. And then when the EEGs, the electroencephalograms, appeared, well, then it was proven that epilepsy was a real brain disorder. And so nobody doubted it anymore. And then tons of research happened and it was treated. And so now epilepsy has a very different flavor than a demonic possession. It is a true neurological disease. The same is happening for migraine, but we do not yet have a proof, like a blood test or an MRI or a CT scan, that we can use in clinic to prove that you have migraine. We have such tools in the research world, but not in the clinical world. So I think that's one of the reasons why migraine is still stigmatized, but it's improving. Now let's get to the meat of it. Okay, so what Migraine Canada is doing to improve how you can live with migraine in the workplace. What did we tell employers to do? And if you have ideas, we'd love to hear from you. Okay, so here are some ideas. So we would love to have a program to propose to employers so they can just educate their HR people, human resources people, and employees at large about migraine. So people understand what migraine is. So such a program could be really good to router says that my connection is not too good. All right. So what we want to do about the workplace is awareness, so education. Then we want to for the employer to have resources for people living with migraine, um, and then we want them to. I'll have to say to people, stop texting me because it's a bit disorienting. Okay. We want people to encourage medical management to say it's okay to see a doctor for migraine and it's okay to have allied health care like physiotherapy or psychology or occupational therapy or osteopathy or other things to help you. We want to break the stigma. So if you live with migraine, people should not look at you as you're weak or you don't know how to manage your life or you should just stop eating chocolate. And that's true education. And then we can tell employers to provide you with useful things, such as flexible schedules, a no sense policy, light adaptation, right, to avoid different lightings that can trigger migraines, and have an optimal desk so you have a good posture, to have water breaks, to be able, and especially if you have a bad migraine and you need to skip work, not ask you to go to the emergency department to get a doctor's note because that's a very bad use of medical resources, especially now during COVID. So there has to be a trust and collaboration with the employer. So there's a lot that can be done. Then what can you do to kind of make this relationship with your employer and coworkers better? Well, you can become, you can take things in your own hands by becoming a bit of your own expert, right? So to use a headache diary, to be aware of your triggers, to be aware of your frequency, to be open in a reasonable way with your coworkers. Often the coworkers will kind of know if you are at work with a migraine because it sometimes, it shows. It just shows in your face and how you behave. And inform colleagues and maybe tell them to go on Migraine Canada so they can learn about migraine, right? And then, of course, if you need medical care, seek it, right? And we all know it's difficult to find a doctor, and it's even more hard to find a headache specialist. But do what you can, right? To seek to find the treatments that work for you. And then finally, be kind to yourself. I always tell this to my patients. Migraine is a disease of the brain, and sometimes it will impact your capacity to work. I have patients who are on disability. I have patients who are able to work 3 or 4 days per week. I have patients who had to kind of reorient their careers because of migraine. And this is true for any serious medical condition. So don't flog yourself to death saying that you're weak or that you're just a bad person or you should do more. Because the challenge with migraine is to kind of know your limits, do the best you can, but then sometimes you just can't do all you want to do, and you have to accept at least part of it for a while. So be kind to yourself. Now we'll move on with 3 takeaways that I wanted the audience to, including like the benefit people, the insurance people, and the employers, to get from the talks I gave. The first one was cover the medications. Okay, choose a drug plan that allows people to have access to second line issues like options like Botox and GRP antibodies. And there are more to come. The GPANs are coming now. And by the way, you can have a look at our excellent webinar. I'm promoting myself here a bit on GPANs that is on YouTube. Then we want, of course, insurance companies to adopt reasonable criteria, right? Those options should not be the last resort. It's fine to try known options first, but please don't ask patients to try everything before they can access second line options. And then if a patient finds something that works, right, cover it for a long time, because migraine is partly genetic. It's not going to go away. You cannot just cure it like an infection or cancer that you can kind of treat forever. So there's no fixed cure for migraine. So if you are a success, if you take some, I shouldn't say that, if you do get a relief with a CGRP antibody or Botox or whatever else treatment, right, then it should be covered for as long as you need it. So those are the messages we wanted them to get. And then, are we aware of the impact our presentation had? Yes, because we got very good feedback documents. All of this is, of course, statistics. So as I mentioned, 97% of attendees found that the presentation helped them to better understand new treatments, migraine, the causes of migraine, the symptoms of migraine, and that is very likely to make a difference for these employers. The Canadian agencies for drugs, even PCPA, the Pan Pharmaceutical Alliance, that discusses the costs of medications for the public payers. We are engaging with healthcare ministries in all provinces. We send letters to all the provinces, and it's very important because there are smaller provinces. We're not forgetting you. And we will also be partnering with GPAC, which is the Global Patient Alliance Coalition, Advocacy Coalition, to implement programs in the workplace. So that's coming up for 2022. So thank you so much for listening. Your support is so important to us, and this support can come in many ways, and mostly by promoting and diffusing Migraine Canada, talking about it, telling other people with migraine about it. And then if you want to volunteer, and soon we'll be a charity, so you'll be able to donate to support our efforts. So we want to help you, and I think that at present time, the employers and the insurance companies and the healthcare ministries and public payers are all in our network. So we are doing work, and we hope that this work makes it to you so you can have access to treatments if you do need them. So I'm not too sure if I can look at the chat. I think there are a dozen people here, 9 people So if you have any questions, there's a comment here. Thank you for sharing. So if you have any questions on this topic for the next minute or two, I'm happy to take them. And yeah, it was a pleasure to interact with you, and soon we will learn to use Facebook better. So I'm looking at the chat. So if you want to chat and send a comment or question, that's your moment. That's your time. All right. I see no question. Well, that's good. So I'll take it as I was very clear. So stay tuned for more webinars and more information from us. I wish you all the best to find relief and to get access to the options that help you living with migraine or any headache condition. And on that, I'll wish you a very good Friday. Oh, is there a way to receive the newest updates? Yes. If you actually go on our website and you sign our petition, you will be put on our mailing list. So if you go just right on our website to look for petition, and then you can actually get updates. For the record, we do not have yet newsletters because we're just like, we have so much to do. But we are planning to do newsletters so you can have updates on a regular basis. So Chantel asks, are there suggestions for dealing with migraines while pregnant and triptans are not an option? So that's a very interesting question. I will recommend our YouTube webinar with Dr. Rose Giamarco about hormonal issues and migraine. Pregnancy is a very sensitive topic, so of course I will not like give medical advice, but there are options that you can discuss with your physicians regarding this. But I think it's better if I do not advise you in this fashion on pregnancy. But yes, there are options, and there's actually things you can discuss. All right, and Carol says thank you, so I'll say thank you for that. And on that, I think I will close and wish you a great afternoon and weekend. Bye, everyone.